pericardial effusion. What is the clinical features of pericardial? What are the causes? It may be large heart is large. Multivalvular heart disease, cardiomyopathy. But it is not a large heart. How to differentiate from the large heart from pericardial effusion? This is very important. I am telling you. That's okay. So how to differentiate? So this is, if you measure a cardiothoracic ratio, this is from the one. Okay. আরেকটা পেন দাও এখানে ম্যাক্সিমাম সাপোজ 4 সেন্টিমিটার এদিকে যেখানে ম্যাক্সিমাম এখানে সো কার্ডিওথোরাসিক রেশিও is almost 70% of if it is more than 55% ম্যাক্সিমাম বেশি হবে because of cardio কেউ বলে 50 অ্যাডাল্ট রেখে 50 আমাদের পেডিয়াট্রিক তাহলে এখানে কি দেখতে পাচ্ছি একটা লার্জ কার্ডিয়াক সেপ নাও হাউ টু ডিফারেন্সিয়েট ফ্রম pericardial effusion with cardiomegaly in the pericardial effusions normally the border of the heart is maybe mild obscure কেন বলতো তুই যখন ছবি শুনছিস when you take a picture you are moving তাহলে কি হয় এই যে the heart তোর জন্য তো বলবে না রেডি থামবে না তো হার্টটা চলতে থাকছে তার জন্য the border of the heart কি হয় একটু মাইল্ড হেজি হয় বুঝতে পারছিস তোর জন্য তো থামছে না সেই জন্য চলতে থাকছে but when there is a collection of the fluid outside the heart তখন তো হার্ট তো ভেতরে করছে ওর মধ্যে অত চেঞ্জ হচ্ছে তার উই গেট এ ক্লিয়ার বর্ডার ফার্স্ট হচ্ছে so cardiac border will be very clear. Second is the flux shape heart, Ottawa shape heart means base of the heart then this collection like this way. Collection of the heart. Cardiac silhouette is typical like this way. In the case of cardiomegaly, there will be same silhouette is maintained but it is enlarged. But in the case of pericardial effusions, due to collection of the fluid outside the heart, it seems like flux shape heart, like in the chemistry flux, like Ottawa shape, like this way. And the border will be very clear. Why clear? You understand? There is collection of the fluid, so the heart is moving inside that, so that is a clear cut border actually. Second is the angle. This angle will be very prominent. Cardiothoracic angle. Or an important portion হচ্ছে in pericardial effusions. Remember, if you go to the clinical method, clinical status, when there is collection of fluid, the venous region will be decreased. So the bronchoalveolar margin will be less blood goes to the lung. So in that cases, we may get some audit. So we take it from the book. What are the features? Just this is an overview. Yes, time and the task which you have pericardial effusion, how to define pericardial effusion, who is normal cardiomegaly, what are the causes of cardiomegaly, what are the causes of pericardial effusion, what are the clinical features of pericardial effusion, how we treat that. You see here also the same picture, the finding gas is very common, no? This is the finding gas.
So in the first X-ray you had shown there were two gas shadows. One was the pointing and the other was the colonic. Which one? How do we differentiate?
Not this. Yes, see, that is overimpose. Initially there is finding over the. So this all together. This is an X-ray where the upper mediastinum is widened. Cardiac silhouette is well maintained, but upper mediastinum is widened. Upper mediastinum is widened, which will be given in the exam. But remember, when the upper mediastinum is widened, then if the age of the child is infant age group, always think of thigh mass. As such, in this particular age group, the thigh mass give a large shadow. You don't know cell sciences and you don't know. If it is the heart, suppose the thigh mass like overlap like this. So when the just above the heart is making cast a shadow, sometimes making confusions. What is this shadow actually? And as it is mild concave, it is like a sail of the boat. একটা বোটের নৌকা যখন পাল থাকে সেটাকে আমরা concave থাকে সেজন্য এটাকে বলে sail sign. Second sign is Indian sign. Indian sign means this is continuation of the cardiac border which we have made, but there is a notch. the upper mass is not the same continuation. So this is known as the knot sign. So if you think in a small kids like 1 year, 2 year maximum, that is a large shadow in the upper brainstem, the first diagnosis should be thymic shadow. After in the highlight regions, sometimes other DD, if it is not thymus, if it is thymus, which in particular shape will be there, more prominent on the right side, less prominent on the left side. It will make a cell, maybe indentation like this way. So other DDs commonly in pediatric age is the highlight lymphadenopathy. We have also patient here, highlight lymphadenopathy. Besides tuberculosis, we should think of lymphoma, maybe leukemia also. Highlight lymphadenopathy is the, but whenever there is a lymph node in the highlight region, it should be outwardly convex, goal, like the outside at a convex border will be convex one. এরকম একটা লম্বা other diagnosis.
upper lobe pneumonia. Right upper lobe pneumonia.
Upper lobe. Very old X-ray, probably not given in the exam. But in a case of thalassemia, all you know, in a case of thalassemia, chronic hemolytic anemia, as the child is suffer from hypoxic insult, so that is proliferation of the bone marrow. It is more common in the any type of flat bones, where there is marrow cavity expanded, like sternum, vertebra, maxilla, and also the bone of the skull. So in the skull, there are two plates, diplex plate, outer table, inner table, and you may get some widening of the medullary cavity. Sometimes you may get calcification along the blood vessels leading to here. Here on in মানে you do know the mean এই চুল কেটেছে 10 পা চুল কেমন স্টিক এটা কেন হয় সে ক্যালসিফিকেশন अराउंड the vessels বরাবর ক্যালসিফিকেশন হয় বলে স্টিক ফার্স্ট is not here on in বলবে ফার্স্ট বলবে that is widening of the deep leg space outer table inner table একটা wide এটা is ফার্স্ট তার সঙ্গে অ্যাসোসিয়েটেড এটা পড়ে নেবে কোন ডিটেইলসে পড়া যাবে না এখানটায় দেখে নাও এখানটা আবার সেম রাইট লেফট দেখে নিলাম রাইট লেফট কার্ডিয়াক সিলোটিজ ওকে bony changes নেই দেখছি the angle this angle is not obliterated costopenic angle cardiopenic angle here cardiopenic angle is clear but this right sided costopenic angle is obliterated so there may be some mild corrections but what is more important there is a thick wall circular structure here কি হতে পারে নিউমাটোসিল অত ঠিক ওয়াল হবে
Lung abscess.
বাট ক্লাসিক্যালি অ্যাবসেস স্টুডেন্ট হরাইজন্টাল ফ্লুইড লেভেল কিন্তু এত ঠিক ওয়াল থাকলে এইটা হচ্ছে নিউমাটোসিল হতে পারে ব্ল্যাক দেখতে পাচ্ছিস দ্যাট মে বি নিউমাটোসিল and pneumatic commonly seen in pediatric is used as staphylococcus এটা ওল্ড পিকচার বাজে হয়ে গেছে এটা কিসের এক্সট্রা মনে হচ্ছে এটা দেখ হেয়ার অন এন্ড কত বিউটিফুল আছে
এটা ভিমবাজের রিং সাইন না
এই দেখ হ্যাঁ স্টিক ওটা থ্যালাসেমিয়া মানে you do not turn thalassemia until chronic but there a teacher may ask you why that is so you have to know underlying cause of that এখানে কি আছে there are two pictures you should not too confuse yourself that any skull X-ray means thalassemia no you should not think of that there may be normal skull X-ray there may be enlarged pituitary fossa there may be a skull of hydrocephalic skull many things can happen a skull of MPS just look skull এসে গেল face come outside thalassemia তারপর আপনার চেঞ্জ করেছে অন্য skull দেখুন you should know that you should be confident you have the possibility to take time and then পরে বন্ধু এসে গেল, স্কাল ওখানেও ছিল, বোথ অফ স্কাল পরে আমি পাস করে বন্ধুর কাছ থেকে হেল্প নেওয়াটা মেবি আচ্ছা এখানটাতে কি দেখতে পাচ্ছি
সেকেন্ডটা তো রিকেটস গোইং অন
commonly in the bony X-ray that many things can happen, but commonly given, I'm not saying all the cases, it is rickets and scarring commonly given. So it is your task, tell it properly what are the features of the rickets, and I'm just showing you what are the features. So theoretically, you know what is rickets, what are the body parts of rickets, why that is bony changes occur, how investigate and treat. Because subsequent question after identification, some one or two question will come. How you confirm other supportive other investigation and how you treat them. So this is read it, rickets and start with right now. I'm showing the picture, but in the exam you have to supportive answer you have to reproduce. So in the case of rickets, possibly there are other rickets. You see this X-ray, why there is some widening of this portion is known as metaphysis, and it is irregular, that is rough and irregular. So you should be very concept, the term commonly used is the widening, talking, praying and playing. What does it mean? You should be confident because examiner actually put it into the cup. So cupping means rickets is a disease or there is defect in calcium. So the osteo is lack of calcium. So it is a weak. So whenever the child starts crawling, so that is widening of the disc because it is a weak one. At a mark, if you like a clay and place it like this way. Similarly in the leg also, when you give pressure, due to pressure of the body, most of the time in a weak bone which not get calcified, leading to cupping. If you make a clay and you place it like this, this is cupping. Although it is not very prominent here, in some cases it will be very prominent. Here is a bit of better prominence than upper one. Not all X-rays see the classical one. Cupping should be here, as for example, here it is not very prominent. It is straightening, but it should be cupping means inward cupping. That is a cup. Praying means in this portion there is an irregularity of the bones with irregular pattern. Irregular structure. That is the fraying. Fraying means if you see the margin এরকম থাকার কথা মানে এখান থেকে আরো ছড়িয়ে এটা বোন মেটাফিজিক্স তারপর এপিফিসিস আসছে এটা that is fraying. So cupping, fraying, all these things. Sometimes you may get a white zone. White zone of calcification means whenever we start treating the patient, if we take an X-ray after 2 weeks, that indicates if the patient is recovering. So everybody should be familiar and confident regarding rickets. What are the causes of rickets? What are the different types? What are the treatment? Make it in your lips. So these are the treatment if you do this. Question এখন ওপেন হয়ে যাবে। if you make a practice না করতে হবে না। পরীক্ষা আমাকেও দিতে দিলে আমি ফাম্বল করব। বুঝতে পারছিস? Exam is such a place that fumbling হবে। How we can decrease it? If we make a practice. Practice না করতে হবে। বললে হবে না, রিডিং না। বলে প্র্যাকটিস করতে হবে। Suppose there are 4-5 points. You ask your friend to say match, you tell the match like this way. You make a practice in the practical. It also replaces possibly, but here tapping is more prominent, but there is less praying here. So all the picture may not be present in the same way, but you should know what is answer. And that is a scar view possibility. This X-ray is a possibility of the scar view. Scar view, lot of changes can occur, but very importantly is that the outer margin will be very clear cut, pencil-like or X-ray can say. The outer margin is very clean cut, and if this is epiphysis, the outer margin is prominent. Ring bole? Ring means it is round. The outer margin is more opaque than the inside ones. So make a ring. There are also a lot of other features is there. You go through the book. There are a lot of things that may be fracture. Remember, in the case of rickets X-ray, you may get X-ray where there is also fracture. And it's a weak bone, chance of fracture. So we also make a X-ray in the exam. There is a fracture also. So your diagnosis should be that this X-ray of the lower limb showing features of rickets, alluminated fracture in the lower to bottom positions. Then what your diagnosis? What are the points in favoring of your diagnosis? Shows is this. Then how you confirm other investigation? How you keep that investigation? Why you are calling this case of scar tissue? There are 4 or 5 points as there. Not present all these cases. But very importantly, 3 features is there: outer pencil-like cortex, ring-like manner, and some cases not to the old extent. There are some hypolucence of the medullary cavity become very lucent actually. So return from the book, all the picture you are given in the book. Like this patient you see. This also seems to be scarred. Medullary cavity কি হয়েছে?
Hypolucin.
Cortex is thin, pencil like that. So these are the X-ray. এরকম X-ray থাকতে পারে। Suppose if this X-ray then we can both the lung filters and patchy opacity, obliterating both these angles. Remember, any type of pneumonia may have some effusion known as the pan pneumonia. So mild collection of fluid in the case of pneumonia is quite common one.
So আগেরটাতে নিউমোনিয়া মানে একটা প্যাচি যে কনফার্মেশনটা
প্যাচি নিউমোনিয়া এটা মনে হচ্ছে ইয়ার আন্ডার রয়েছে তাহলে এটা ইয়ে হবে তুমি বলবে কনিক হিউম্যানিটি নিবে তাহলে সে বলবে না ইভেন ইন দা প্র্যাকটিক্যাল ক্লাসে ইন দা long cases also, if this case of suspected thalassemia, we tell chronic hemolytic anemia. This is the standard teaching actually. Right and left is not to mix it. Position, right, left, this is right, this is left. First. Okay, now go, not hurry. Trachea, no bony changes, come to the lung, come to the heart. It seems that the heart from the midline, 1/3 of the heart should be on the right side. But here seems it is more than more heart comes out. So it give an impression there is something here which pushing it. What can push? Anything. It may be yard, it may be pus, it may be blood, it may be simple fluid, something. But here see this portion is opaque, obliterating both the cardiophenic and costophenic angles, and there is an opacity also here. And if it is these portions have bronchoalveolar marking, so that indicate compressed lung. Suppose this is totally black, then your diagnosis should be hydropneumonitis. So it is water, means pleural effusion is there. How? Homogeneous opacity, obliterating both the angles. But what is this? This is compressed lung indicated by the presence of bronchoalveolar marking. Or sometimes you may get a patient that pleural effusion and above it, that is ear. And in that cases, as ear gives some pressure, it is horizontal. Remember, horizontal fluid flow. Upper portion is ear, lower portion. Tongue will be high flow. And this is left side pleural effusion, and this is a compressed lung. Out of the features, homogeneous, no bronchoalveolar marking, shifting of the mediastinum, and it compressing the lung.
And the concave upper marginal.
It is also partially concave.
Partially concave.
Remember, if this type of experiment is given, but see the right part of the heart, so it is very low lymph. Actually, not this type of experiment.
সেটা লিম্ফ নোড ছিল আগেরটা
See this type of experiment. না এটা তো ফান্ডিং আমাদের হার্ট in the exam the classical should be given. If any hand, the hand should be any classical. এটা দেখ again you start. This is a chest X-ray, although abdomen should not be taken. This is right, no bony changes, lung angle is clear, compression marking is okay. Look at the left side. Here this ear never miss, this ear is costophrenic angle. This is ear possibly due to some left colon action, splenic flexor action. And this portion is black. This portion is black. Those who are from the distance, see this portion is black and this portion. 2 or 3 come here. The difference between the two black is 2. One is more black. So what is the difference between the two black? This more blackish. Each have some bronchovascular marking, each have some bronchovascular marking. And that is ER. What is the ER? Inside the lung, it is pneumatocyte. No, it is outside the lung. And this is collection of the fluid here. So this is hardening both lung. And this is like a balloon-like structure with compression. This is a compressed lung. Because it is not a lung is not a two-dimensional thing. It is like this way, encasing. The pleura is encasing whole way. So outside those pleura is full of air. So the lung is compressed.
এখানে বা কস্টোফ্রেনিক অ্যাঙ্গেলটা নিচেরটা নয়,
ওটা গ্যাস সাইড ক্লিনিং গ্যাস
পসিবলি স্প্লিনিং এরকম থাকবে না। The angle is not seen. What is the angle? This here possibly this is splenic flex মানে কোন?
মানে আমি রাইটের রেসপেক্টের লেভেলটা যেমন দেখলাম, হ্যাঁ তো
দ্যাট শুড বি angle. অ্যাঙ্গেলটা খুব ক্লিয়ার হতে হবে কিন্তু। দ্যাট উইল বি কনফিউজ।
আমার তো নিচের অ্যাঙ্গেল মানে নিচে এটা নয়।
না না না, এত নিচে আছে।
হ্যাঁ এইটাই লেভেল, হ্যাঁ আচ্ছা। হ্যাঁ
তো প্লুরাল ডিফিউজ একটা নিউমোনিয়া, লোবার নিউমোনিয়া একটা দেখলি হবে। এই একটা এখানে একটা
নিউমেটোসিল। হ্যাঁ
দরকার নেই। ইউ উইল টেক দ্য ডিডি, লাং অ্যাবসেস হতে পারে বা দ্যাট শুড বি এ ফাইজেন্টাল লেভেল, একটা ব্লাড নিউমোটোসিল হবে, ওগুলো দেওয়া হবে না। তার কনফিউশনাল এক্সরে দেওয়া উচিত না, আমরা নেওয়ার চেষ্টা করব। Classical heart, it may be cardiomegaly, it may be pericardial effusion. If it's classical, good safe heart can be given. See the difference between the previous one, where there is called cardio pericardial effusions. Pericardial effusion.
এখানে মার্কিং বর্ডারটা।
Pericardial effusion here, cardiac salute is relatively well maintained. Cardiac salute is relatively well maintained. In the case of pericardial effusion, like a tuck shape all over due to collection of fluid. So it is cardiomegaly. So in that case, if this is the case, the examiner will ask you measure the cardiothoracic ratio. The method, you not to measure 3 cm per cm. What is the method? So method, everybody should be clear is that from the midline. In this case, we will not be giving because right border is obscured here. Or when right border is seen, from the right border, this level suppose is the maximum, but here is the lower level, and add to that.
এটা ডায়াগনোসিস মানে কার্ডিওমেগালি ছাড়া রাইট বর্ডারে যে অবস্কিউরড ওটা নিউমোনিয়া।
ওরকম ইন দ্য আন্ডারগ্রাজুয়েট কমনলি দেওয়া হয় না।
ফুড পালমোনারি হাইপারটেনশন যেগুলো তো হতে পারে।
ঠিক আছে, আর কিছু দেখতে হবে না, এগুলো করলে আর অনেক কিছু থাকতে পারে। এটা একটা প্রোটোটাইপ এক্সাম।